June the 1st, 1987, the newly built grey building on Road Number 2, Banjara Hills, Hyderabad in India, stood ready to open its doors to all those who would come seeking eye care. It was the culmination of several months' activity and hard work that began with the first shovel dug into the ground to lay the foundation stone on October 17th, 1986. The idea born and nurtured since early 1982 by Dr. Gulepalli Nageswara Rao and his wife, Mrs. Pratibha Rao, to return to their homeland and provide world-class eye care services was taking a concrete shape. Triggered by the inequity in the Indian society and its extreme manifestation in healthcare, the underlying thought was to reconcile excellence with equity. A single man's dream had become a collective vision of many. In gratitude for the initial support received from the legendary Indian filmmaker Sri Akineni Lakshmi Vara Prasad Rao, popularly known as LV Prasad, the institute was named LV Prasad Eye Institute. On the day of the inauguration, June the 1st, 1987, the guests of honor were the first two patients. One was a young boy from an affluent family, and the other was an elderly gardener who lived on a daily wage. Both were received with the same respect and attention. From the very first day, there was strong adherence to the mission, administering care to every person who walks into the Institute, irrespective of his or her ability to pay, and to provide 50% of the services free of cost to those who cannot afford it. Blindness can be prevented or cured in 3 out of 4 people, but those excellent odds are rendered useless if patients cannot access treatment because it is too expensive, of inferior quality, or just geographically distant. The initial vision was limited to establishing a center in Hyderabad focusing on patient care, education, research, and later rehabilitation. But as LVPEI started delving deeper into the field of eye care, the scope and reach of its activities broadened. The LVPEI pyramid of eye health and its 10 functional arms that cover all aspects of eye care services evolved. The 5-tier eye health pyramid model, covering all sections of society, right from the villages to the city, is today providing high-quality, comprehensive, and advanced preventive, curative, and rehabilitative eye care to all. At the apex is the Center of Excellence in Hyderabad, and at the base, holding it up, is the care that reaches the doorstep of the poorest person through locally recruited volunteers. Layers of centers in between, primary, secondary, and tertiary centers, form a strategic machinery that suitably treats the patients and refers them to the level of advanced care when needed. The Institute's eye care network has blossomed into 220 plus centers and one overseas partnership in West Africa, the Liberia Eye Center in Monrovia. The Institute is recognized as a world leader in eye banking and corneal transplantation. The focus now is also on setting up eye banks in other states of India, where they are needed the most. With a strong commitment to train human resources across all cadres in the eye care service delivery chain, LVPEI is grooming professionals. The advanced work done by LVPEI in ocular research is helping the team provide solutions to many unanswered questions in the treatment of eye diseases. The technology and the innovation work at the Institute are focusing on bringing down the cost of healthcare and to make high-quality eye care accessible to the community, regardless of geographic and monetary challenges. Providing low vision and rehabilitative care to those with incurable visual disability continues to be the strong focus area of the Institute. LVPEI is also playing a key role in the implementation of various eye health initiatives, universal eye health programs, in partnership with state governments. Receiving the very prestigious Greenberg Prize in Blindness 2020 and the inauguration of the 200th Primary Eye Care Center were both a deserved recognition and a true celebration of LVPEI's aspiration to eliminate avoidable blindness by 2020. While a significant work touching millions of lives is already accomplished, yet a lot more needs to be done. The final goal is every village in a remote rural location anywhere in the world should have access to the best possible comprehensive eye care. In future, LV Prasad Eye Institute will work on the combination of 3 T's: talent, technology, and tenderness and it will continue the saga of a caring institution with relevance and impact, so that all may see.